All right, so there's a lot of symptoms here, but the chief of which would be visual snow. So here we go. So the first thing we see are these elongated styloids that come all the way down. Here you can see they'll be making contact with the internal carotids bilaterally when you bring your head down. This is the arterial phase we're going to show first. So you can see how far in front of the internal carotid, which is right there, that the styloids are. And it looks like the right one's going to hit faster. And in a moment, we'll show you that the styloids are actually knocking the atlas out. Particularly the left one, it's not, actually, it really knocks it out pretty far and rotates it. C2 is actually rotated also further to the right. So C1 and C2 are being knocked out by the styloids. And any looseness up in here that we're going to have at the cervical cranial junction is because the styloids are pushing it and causing it to be mechanically levered. All right, so there's the arterial phase. Let's bring the venous phase in front. And before it can even get to those carotids, it's choking the jugulars bilaterally. As soon as you bring your head down, the jugular is going to be pinched between, and it's going to be on both sides. And pretty quickly the styloid is going to knock the atlas out. So when it comes to visual snow, there's a lot of speculation on it. We know that when you back up your jugulars like this, you're going to have a buildup of metabolites. The cerebral spinal fluid drains into the venous system by a pressure gradient. That is, for the CSF to urinate or excrete into the venous system, the pressure has to be low in the venous system. So if you have a buildup of metabolites, and everybody's biochemistry is a little bit differently, you could easily have a buildup of metabolites in the brain that are inflammatory. Actually, there's even antibodies against these metabolites, according to Dr. Damadian, the guy who invented the MRI machine. So if you're going to have antibodies against some of these metabolites, it's not that far of a stretch to think that the optic nerve could get attacked and inflamed from this thing. This is all speculation, but it's as good a theory as any. All right, so we've got your jugulars, we've got your styloids, we've got your internal carotids. Let's bring this over here. The other thing we have is your first rib is knocked down on the right. So again, we want prolotherapy to tighten that up, raise that up. It will turn off the scalenes. And actually, before we go into that, let's bring this up. So remember your anatomy. This is the styloid. This is actually normal anatomy. Your styloid goes across both the jugular, the internal carotid, and all of these nerves. As a matter of fact, it could probably even go all the way over here to the cervical ganglion. So when you're in front of a doctor and he starts asking you your symptoms, perhaps you could show him these still shots, this report, and ask him, what symptoms do you expect me to have with a styloid coming across? And as a matter of fact, that's the superior cervical ganglion on the medial side. You have the internal carotid plexus. You have the pharyngeal branch of the vagus. You have the glossopharyngeal. You have the spinal accessory nerve, the anterior ramus of the first cervical nerve, the hypoglossal nerve, the stylopharyngeal branch of the glossopharyngeal nerve, the carotid sinus nerve, which is very interesting, the carotid body branch of the vagus, and the jugular nerve. And if you trace all that stuff out, I mean, it's everything from blood pressure to passing out to vasovagal responses. Matter of fact, the list would be too much. That's why you say, hey, doc, what symptoms would you expect me to have if I had a calcification coming all the way across that's jamming into any one of these structures at any given time, especially since when you move your head. And that way, well, whoever speaks first is going to sound kind of crazy. All right, so we have the first rib. Here is the C2 is rotated. You can see that. Here's another shot of that atlas digging in on the jugular. Another good shot of that. There's a good shot of that. Here we are on the internal, you can see that. Okay, now here we are looking at the alignment. Now I drew a line through the foramen magnum. There's your atlas. You can see how it's rotated and knocked this way. It looks to me like the styloid is knocking your atlas and rotating it in that particular direction. And then C2, here's C2. That's even going further. There's another shot of it. Okay, so the issue is how unstable are you? How hypermobile are you? Well, this is left and right head rotation, and the skull is not rocking over far at all. There's plenty of space between the odontoid process and both. You look very stable. Not to mention that you're very muscular, and I do applaud you for getting into the gym, turning yourself into a muscular, stable person, because you knew that you were slouching in high school and you had adopted this position that is common to our teenagers these days, and you said no more, and you built up enough muscle, and you have the most perfect posture I've ever seen, and you're tall, and you're doing everything right. I think now it's time. I don't think these styloids need to be there anymore, because you've stabilized yourself with so much muscle. Okay, any questions? Anything you want me to talk about?
No, it's just it's fascinating imagery, and it's not only are we blocking the jugular vein there, but we can also see evidence of nerve damage, vagus nerve damage from my uvula.
That's right, your deviated uvula to the left, so the right vagus is clearly compromised.
Right, exactly.
Neurologically.
Yeah, so that's an interesting indicator to me.
Mm-hmm.
So.